Hey everyone, it is December 31st, 2013, so Happy New Year everybody. I hope your 2013 was great and your 2014 even better. It's not a coincidence that I picked today to make a video because the topic today will be Obamacare. A lot of the key aspects turn into law tomorrow. So this is a good time to fill everyone in on what we've got ourselves into, good or bad, whatever your feelings may be. I'm going to break this video into 5 categories, and I'm not going to ramble too much on any of the categories, so hopefully we'll get through this pretty quickly. The 5 categories I picked are promises, legality, enforcement, the website, which we've been hearing a lot about lately, and privacy concerns. So let's jump right into it. Let's jump into promises. Let Obama talk a little bit himself here shortly. Roughly 16 million Americans will lose their current plans because of Obamacare, despite being told by the president himself that, if you like your plan, you can keep your plan. If you like your doctors, you can keep your doctors, and so on. We've heard that so many times. As a matter of fact, here is Barack Obama telling you that himself in his own words.
I said this once or twice, but it bears repeating. And you can keep your plan if you are satisfied with it.
If you like the plan you have, you can keep it.
If you like your plan and you like your doctor, you won't have to do a thing. You keep your plan. If you like your health care plan, you'll be able to keep your health care plan. If you've got health insurance, you can keep it. If you like your health care plan, you will keep your plan. If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan.
If you have insurance that you like, then you will be able to keep that insurance. If you like your doctor or health care plan, you can keep it.
If you like your health care plan, you can keep your health care plan. If you like your health care plan, you can keep your health care plan.
If you like your private health insurance plan, you can keep your plan. If you like your health care plan, you can keep your health care plan.
If you like your private health insurance plan, you can keep it. If you want to keep the health insurance you got, you can keep it.
If you like the insurance plan you have now, you can keep it.
And if you like your insurance plan, you will keep it. So if you like your plan, you can keep your plan. If you like your plan, keep your plan. If you like your current insurance, you will keep your current insurance. If you like your plan, you can keep your plan. If you like your plan, you can keep your plan.
If you're happy with what you got, nobody's changing it.
So, what a guy. Not only that, but in November 2008, Obama said, quote, "We are going to work with you to lower your premiums by $2,500. We will not wait 20 years from now to do it, or 10 years from now to do it. We will do it by the end of my first term." So, what he's saying here isn't that everyone's guaranteed to have their premiums lowered by $2,500. He's saying that the average family will have their premiums dropped by $2,500. However, by the end of his first term, family premiums had gotten bigger, not smaller. The increase was $3,065 per family. And it's only going to get worse, apparently, with Obamacare. An analysis of the HHS numbers shows an increase of underlying insurance rates for younger men by an average of 97% to 99%, and younger women by 55 to 62%. If you're in North Carolina, just forget it. Individual market rates triple for women and quadruple for men. The numbers are pretty staggering all over the U.S. As the economy takes a dive, people are forced to give even more of their health insurance plans, give even more to their health insurance plans, and they are getting less in many cases. Let's move to legality. It's no wonder people are really attacking the legality of the law. Not only is the individual mandate not authorized by Article 1, Section 8 of the U.S. Constitution, but even once the law was passed, the President amended the regulations. The amended regulations totaled 11 million words in length. By definition, This is illegal since it was not approved by Congress. Further, after Obamacare passed, the unions that supported the law requested and received special exemptions from the law. More than 1,300 organizations received these exemptions. This also was illegal because it again was not passed through Congress, but rather simply granted. Further still, the Constitution requires the law to treat everyone the same, which also is conveniently ignored. The hypocrisy of people who wildly supported the bill is frustrating enough in itself. In December of 2012, Al Franken, Elizabeth Warren, John Kerry, and 15 other Democrats wrote a letter to Harry Reid asking him to delay the tax on medical devices, which is part of Obamacare, claiming that the tax would hurt job creation in their districts. So I guess other districts around the country should be ignored. I don't know what that logic is. As expected, plans to lay off employees at those manufacturing facilities came to fruition. Welsh Allen, 275 workers, Stryker, 1,170 workers, and Medtronic, 1,000 workers. It didn't stop there. Then the politicians that supported the plan wanted additional exemptions for themselves and their staff. Once again, Obama made the changes and didn't allow Congress to vote on them first, making it legal. Which, of course, makes sense because you wouldn't want the public to see Congress voting on giving themselves exemptions from a law they have forced upon everyone else. Although Obama had made a campaign promise to have healthcare negotiations broadcast on C-SPAN, he broke the promise after he was elected. The secrecy of these negotiations was so strong that Speaker of the House Nancy Pelosi famously said, quote, "We have to pass the bill so you can find out what is in it," end quote. Obamacare was then used illegally to give IRS additional powers without approval from Congress. In May of 2013, Health and Human Services Secretary Kathleen Sebelius solicited donations from health insurers to help pay for Obamacare. Of course, such soliciting, you guessed it, is illegal. So let's talk about enforcement. Obamacare raised interest rates on student loans from 5.3% to 6.8% to help fund Obamacare. In June 2013, it was reported that Obama had hired 16,500 new IRS agents to run and enforce Obamacare. Early on, 15 IRS agents illegally seized medical records for 10 million people without a warrant, and Obama refused to fire or prosecute them. Again, this is because you don't want publicity for things like this. So, of course, the IRS agents enforcing the program enthusiastically don't wish to participate in it. In August 2013, it was reported that less than 3% of federal employees wanted to participate in Obamacare. Website, as we know, is an utter mess. Not only does it not work, but it is programmed with utter deception to the customer. When looking at the pricing, the website has two extremely broad categories: 49 and under, and 50 and older. Yet prices for everyone 49 are based on what a 27-year-old would pay, and prices for everyone older than 50 are based on what a 50-year-old would pay. So CBS ran some numbers in North Carolina for a 48-year-old and a 62-year-old. The 48-year-old was told she'd pay $231 a month, but the actual plan ended up costing $360 a month, according to healthcare.gov. The 62-year-old, for the same basic plan, received the price of $394 a month, and the actual price was $634 a month. The website mentions that the prices could potentially be lower, but makes zero mention that the prices could be higher. Government changed the scope of the project while it was nearing completion. Initially, The point was to let Americans browse the plans and see what the prices of different plans were and shop around. We kept hearing Obama tout shop around, like you would on Amazon. Later, it was decided that you must register on the site before even viewing the prices to shop around. And I have to ask myself why someone would want to go out of their way to make this part of the requirement. When someone goes to Amazon's webpage and wants to shop around, what benefit would it be to Amazon to only let people who look at the prices if they go through a registration process? That would indicate to me that maybe there's a reason to dislike said prices. Obamacare gives married couples an annual tax of up to $11,028 for being married instead of single. So that's why, if you also remember Obama saying that they wouldn't tax middle-class people, but to the contrary, in front of the U.S. Supreme Court, the administration had to argue that Obamacare was a tax. Otherwise, it would have been unconstitutional because it wasn't, as I said, authorized by the Constitution if it isn't a tax. So they had to argue that, yes, despite what they say, it is a tax. So let's rule it that way. Obamacare all but openly encourages employers to switch their employees from full-time to part-time by creating this incentive to not hire workers beyond 30 hours a week. If you're over 30 hours a week, you are forced to pay for these insurance costs. And lastly, let's talk about privacy concerns. See, I'm moseying through this, man. I'm cruising. In September 2013, it was reported that Obamacare requires doctors to ask patients personal questions about their sex lives and to put their answers into an electronic database. Most doctors would agree that they have no idea why they would need that information, and it's offensive to their patients to even ask such things. So in response, the administration added the, quote, incentive that doctors who refuse to do this will be penalized. The source code also for Obamacare's website raises questions about privacy. I'm going to quote from their source code. You have no reasonable expectation of privacy regarding any communication or data transited or stored on this information system. At any time and for any lawful government purpose, the government may monitor, intercept, and search and seize any communication or data transiting or stored on this information system, end quote. Again, this is buried in the source code and not written openly for all to view. You would actually have to right-click on the page and go to View Source, then go through all the source code to view this. This is like putting a hazardous waste sign inside the barrel at the bottom below all the waste, or putting a warning label inside of a cigarette. This is real deception from start to finish, guys. I really don't know how to close this video out. There's not a lot of positives to this law, and I think most people are aware of that. And I hate to call Obama out because I'm not that kind of guy that would just focus on a person and not policy or legislation or ideology. I'd rather just focus on principles and not people. But with his name attached to it, it's making it hard for me because I have to keep calling Obama out. Obama. I wish we could just call it Affordable Care Act like it was initially supposed to be. But so this thing, it's a mess. Even a lot of liberals admit, this is a real mess. And there's no looking back. I'm not even listening to Republicans about saying that they want to repeal and replace. I think it might be too late. It's 10 minutes now. I got to go. So take it easy, guys.